bridge has now been pulled apart and the blood can fall
And
back.
would that be the leg that's on the bottom?
It
or
would
the
be,
top?
it could be either.
Either one?
Either, because you figure the leg that's on the top, you're still pushing pressure onto that leg.
Because I have
Okay.
it only in one leg, and I always say it's because I used to always cross my legs.
And that's not uncommon. We do have many patients who will come in and symptomatically they only have symptoms in one leg. So that's not an uncommon thing that we often will hear.
Right.
Other medical issues, things such as diabetes, high blood pressure, are often things that can affect and are related to venous disease as well. And trauma. Many of us think that the trauma that we may have endured on our legs and so forth is just something that was painful to us. Well, it can cause damage to the veins as well. So for those individuals who may have been athletes, you may be very active in sports, or you may have had something fall on your leg, something traumatic. That injury, being kicked very hard, that's traumatic enough that it can cause damage to the valves that are inside the veins. Blood clots are something that affect 1 in 20 Americans. Over 600,000 hospital admissions are annual. We'll see that annually. Pulmonary embolism. This is a blood clot that can travel to the lungs. Like I stated earlier, the blood flows out of the legs into the lungs and the heart. So blood clot that develops in the legs can travel to the lungs. It's the 3rd most common cause of hospital deaths. And years of undiagnosed and related issues can increase can be related to a decrease in the quality of life and also to the mobility of individuals. Some of the signs and symptoms again, how many remember them? Achy, heavy legs. What else? Fatigue. What else?
Cramping.
Cramping, right.
Pain.
Pain, definitely. Itching and irritation. How many think that at this time of the year, all that itching that you have in your legs is just dry skin? And no matter how much lotion you put on it, it keeps itching. Well, I'm here to tell you that that itching may be related to venous disease. The dryness of the skin is not because you need more lotion. It's because you may have problems with your veins. Some of the specifics regarding pain can be as simple as tingling, burning, a throbbing sensation. Some have described it as a sharp pain. So pain can vary. The fatigue in your legs. Has anybody been diagnosed with restless leg syndrome? Heard of anybody with restless leg syndrome? Restless leg syndrome can also be associated with venous disease in that often we've found that patients are diagnosed with restless leg syndrome, and when we've evaluated them, we've found that they have venous disease. And after addressing their problems as it relates to their veins, their restlessness in their legs has been resolved. So it is something that many individuals have been diagnosed with, but it can be something that is also related to venous disease, and until you have the evaluation, then it's not known whether it is indeed restless leg syndrome or it's the venous problem that's causing the restlessness. The cramping and muscle spasm, again, are something that many individuals think that it's just a matter of potassium or it could be a medicine that you're on. Not always. It could also be your veins. So it's something that has to be evaluated. And later on in this talk, I'm going to show you a little short demonstration of how we evaluate and determine whether or not you have venous disease.
Are you just talking about leg cramping, or does it involve the foot too?
It can involve the foot too. It can.
Okay.
The reason being is that the blood, oftentimes what happens is we can find bad valves that are in the upper portion of the leg. But remember, the blood flows downward.
Mm-hmm.
So when that blood falls down and it settles, it's settling in the lower leg
Right.
towards the foot. So often the signs and symptoms can be in the foot and in the ankle, although we find the valves up higher.
Right.
Okay? These are some of the signs you'll see. Some of you may not have any signs at all. Others may just have spider veins. These are the little purplish, pinkish veins that you see. Many of us have those. I have them myself. Spider veins, varicose veins. Now here you can see by this picture, these are the bulgy, ropey veins that are seen on the leg. But one of the things I have to mention is that this is not always the case. You can have varicose veins and not see the bulginess protruding through the skin. Okay, it can often lie a little bit deeper under the skin to where it hasn't developed enough to be protruding through the skin yet. Swelling. The swelling, as I stated earlier, with other symptoms, can be unilateral, which is one-sided, or it can be bilateral, which is both sides. Skin changes. See the difference in the skin here? Darker, a little pinkish, reddish, white flakiness. This is a representation of how some of the skin changes can occur with venous disease. And then again, like I said, it's a progressive thing. So then there's a breakdown of the skin. Some will develop ulcers. These ulcers, when they develop, they don't heal properly because that blood is not getting out of the leg and back to the heart and getting the oxygenation it needs to help heal the skin. Then the skin begins to break down and the healing process takes a long period of time. Once these patients are treated, the blood is rerouted to the good veins, and by that, the oxygenation that's needed to help heal the skin is brought back into that tissue, and the ulcers heal much faster.
I have a question.
Yes, ma'am.
Skin changes on the foot. Is this not something that the podiatrist would have recognized if you had that issue?
I'll tell you, one of the things, part of our company, what we do is we go around to physicians, in addition to doing things like this in the community, to educate the physicians regarding some of these issues as they relate to venous disease. So a podiatrist, he may or may not, depending on how informed he is about chronic venous disease, he may or may not know as to whether or not this is related to something podiatry related or just specific to the foot or specific to the veins. Okay? So it's an education thing. And one of the things we do, we go out to these podiatrists, we go out to many of your physicians we've probably seen already and talked to them about the chronic venous disease and things that, signs and symptoms that are related to it.
Is it that the pink never goes away?
Not necessarily. The pink is just, the only way to determine whether or not it's going to be related to the veins is to have an ultrasound evaluation. But the pink could be something that is related to the veins. It could be other things that it's related to. What causes worsening of the symptoms? Warm weather. Why? Because the warm weather causes our veins to dilate. When they dilate again, we've got venous disease, those valves are pulled apart, and so then the blood is not held. That bridge is not formed to hold the blood in the proper direction and force it to flow in that way. Hormonal changes. Women, this is where we're affected the most, because our hormones affect our veins greatly. Pregnancy. Again, like I said, if you've had multiple children, some women have experienced it just with a single child. Whether you have had miscarriage, childbirth, or not, the effects from the hormones still can cause venous disease. What are factors that you can take on to relieve these? Walking. The muscles, as you are walking, are like a pump in the leg. They push that blood and thrust that blood out of the legs and up into the abdomen, into the lungs, and into the heart. So walking and exercising is a great thing to help relieve any of those symptoms that we've talked about earlier if they're related to venous disease.
Excuse me,
Yes.
at 1:30 in the morning, when you're sleeping,
Mm-hmm.
restless leg, walking,
Yes.
okay,
Well, here's the thing, and give me 1 second and I'll address that, okay?
okay.
So, the other things such as water, immersing yourself, water aerobics. Many of you may find that if you have some of the symptoms that I've spoken about and you are doing water aerobics, you may find that during that time you're not feeling those symptoms. You're not feeling the heaviness of your legs. You're not feeling the achiness, the cramping that you may have may resolve. So those things are you'll find that you'll get relief while undergoing these things. Compression stockings. Do any of you wear compression stockings? You find that during the time that you're wearing them, especially if you have swelling, you'll notice that the swelling is not as great. But when you take them off, then all those symptoms come back. So, to answer your question, when you're lying down, you're not walking around, those symptoms may be prevalent or evident. Only during the time that you're doing these things will they relieve any of the factors that you may have going on. So, in the end, this is merely a Band-Aid effect. The only way to really truly relieve the problem that you're having is to have an evaluation, and based on that evaluation, recommendations for possible treatment. And once undergoing that treatment, if necessary, then you will find the relief that you're looking for, which is now a constant relief and no longer a temporary relief by these factors.
Can
Sorry.
It's okay.
I was just gonna say, if you get the treatment, can it come back again?
This is